Doctors, what was the worst thing you've seen for a patient that another doctor overlooked? A 2-year-old was bitten by a rattlesnake while out in the fields with their dad, not far from a small town. The father rushed the child to the local emergency room, where the doctor looked at the bite and said, "It's probably okay. They likely didn't get poisoned." The doctor didn't give the child the antivenin, which the hospital had, and instead of sending her to our hospital by helicopter, they chose to send her by ambulance. Several hours later, the child arrived at our hospital in critical condition and sadly passed away. To say "probably didn't get poisoned" was a huge mistake. When a young child is bitten by a rattlesnake, the proper response is to assume they've been poisoned and treat them accordingly. This includes administering antivenin and providing the necessary medical support. It's critical to take these bites seriously, especially with children. Next story. From the time I was about 17, I started having daily stomach pain and severe digestive problems. I couldn't eat much anymore, and I alternated between diarrhea and constipation. My periods became extremely painful, and I started losing a lot of blood. Even though I was very small, less than 5 feet tall, you'd think a doctor could figure out it was a gynecological issue. But my doctor, a woman at the time, insisted it was just anxiety. She told me she wouldn't test for or treat any gynecological problem unless I was older and having trouble getting pregnant. Over the next few years, my symptoms got worse. I was sent to many different specialists, but they kept telling me it was just stress or anxiety. They'd ask, "Are you sure you're not pregnant?" Or say things like, "Every woman has painful periods," or "It's just constipation. Take this over-the-counter medicine." Meanwhile, my digestive system kept getting worse. A test showed it took me 6 hours to process a simple meal, when it should have only taken 90 minutes. I weighed only 40 kg. It got so bad I even lost control of my bowel movements. Doctors kept suggesting therapy, or implied I might be exaggerating. At 24, I was unable to work because of my condition, and nothing seemed to help. Then I went to a new doctor for regular health tests and got an abnormal pap smear. Within 2 weeks, I had a laparoscopy to rule out cancer, only to find out I had severe endometriosis. It was on my bowel, cervix, and other organs. I even had an ovarian cyst the size of a tennis ball. The endometriosis was also in my gallbladder. After surgery and treatment, my digestive system started improving within 3 months. Sadly, I found out I would never be able to have children. If my doctor had done her job when I was 17, I wouldn't have lost 7 years of my life. My gallbladder, my fertility, and my mental health. Next story. During my residency, we had a patient in her 60s who was becoming more forgetful and generally losing her ability to care for herself. She had been seeing her primary care doctor, who diagnosed her with dementia, and a neurologist confirmed the diagnosis. She wasn't able to provide a clear history of her symptoms. After talking to her family and friends, it became clear that her condition was progressing much faster than usual. I remember noticing her new hair growth meeting the bright red dye, and her nails, which were painted bright pink. It struck me that not too long ago she was still taking care of herself, even going to get her hair and nails done. The woman in front of me was a far cry from that. The neurologist I was working with recognized the situation, admitted her, and ran several tests, including a lumbar puncture. The results eventually pointed to Creutzfeldt-Jakob disease, also known as mad cow disease, which sadly has no cure. She passed away a few months later, but at least we were able to inform her family so they could prepare for the inevitable decline. It was a very heartbreaking experience. Next story. He mistakenly placed the pacemaker lead in the subclavian artery, crossing the aortic valve into the left ventricle. The correct approach should have been through the subclavian vein to the right ventricle. Unfortunately, he didn't notice the mistake for over a year. I saw the patient, a 25-year-old woman who never needed the pacemaker in the first place, when she was in congestive heart failure, caused by the pacemaker lead damaging the valve. A surgeon and I had to perform surgery to remove the pacemaker and lead and then replace the aortic valve. It was completely avoidable. While 50% of doctors may fall below average, most people believe their own doctor is among the top 10%. Next story. I had been visiting the same dentist for several years, and during every appointment, I was repeatedly told I needed braces and to have my wisdom teeth removed. Both of these recommendations posed problems for me, as I play trumpet professionally, and wearing braces would make performing at a high level difficult, if not impossible. Additionally, having my wisdom teeth removed would put me out of work for at least a month during recovery. Despite telling my dentist about these issues repeatedly, they insisted I go through with it. I decided to seek a second opinion about the wisdom teeth, so I went to an oral surgeon. They took x-rays and reviewed my dentist's records before the conversation went like this. Oral surgeon. So, you're experiencing a lot of pain in your wisdom teeth, according to your records. Me, I am not in pain. Never have been. Oral surgeon. So, I'm just going to assume your regular dentist falsified the rest of your records too, and I can just put this folder down and do my job. The oral surgeon explained that my wisdom teeth were positioned in a way that they were sitting on a nerve, and removing them could cause permanent loss of feeling in the lower half of my face, something that would be a huge issue for my career. I was advised that as long as they weren't causing pain, I shouldn't worry about them. However, I did need to have an adjacent tooth extracted, which my regular dentist had completely ignored when I asked about it. After this experience, I decided to stop seeing my regular dentist, and I'll be starting with a new one soon. Next story. I'm not a doctor, but I'm a registered nurse, and this happened to me. It might not be as bad as some of the other stories here, but it was still a tough experience. When I was in college, I started having trouble swallowing. At first, it was just a little difficult, but it got worse. Soon, I had to swallow food several times or even regurgitate it. And eventually, all I could manage to swallow was broths and mashed potatoes with no chunks. I went to the doctor multiple times, and each time I was told it was just acid reflux and part of my anxiety disorder. I lost 30 pounds. I was only 120 pounds when this started, and I was feeling miserable. Finally, my grandma had had enough of seeing me so sick, so she took matters into her own hands and called the GI doctor. They told her we needed a referral, but after she explained the situation, they fit me in the very next day. They did an endoscopy, and it turned out my esophagus was 95% blocked at the gastroesophageal sphincter. Somehow, some of my primary doctor's notes ended up in my discharge paperwork, maybe because they had to contact her for information. And it turned out that she had told them it was just acid reflux, and that I was being overdramatic. She even said she didn't recommend the procedure. Needless to say, I switched doctors. That was not a fun year. Next story. I'm sharing this again in hopes it helps someone. When I was 26, I found a lump in my breast. Planned Parenthood had taught me how to do self-checks, and I knew this didn't feel like a typical cyst. It felt exactly like the tumors I had been taught to recognize. The first doctor said, "You're too young for breast cancer." I didn't accept that, so I went to a second doctor. He said, "It hurts when I press on it, right?" I said, "No." He responded, "It gets bigger with your period, right?" I said, "No." He insisted, "Sure it does." The third doctor told me, "You'll have an ugly scar if I biopsy it." The fourth doctor, well, I told him to call the police to remove me from his office because I wasn't leaving without a biopsy being scheduled. It turned out I had stage 2 cancer. After surgery, 9 months of chemotherapy, and 3 months of radiation, I was told I couldn't have kids. But I survived. Now, at 62, I have 3 children. If you think the doctor is wrong, get a second, third, or even more opinions. Trust your instincts and listen to your body. Next story. I'm not a doctor, but I've dealt with migraines for years. The pain was mainly behind my eyes, and I thought it was just stress and hormones. The neurologist I saw seemed to agree, and she brushed off my concerns about the pain being specifically behind my eyes and in my temples. She gave me Imitrex and sent me on my way. A little later, I visited my eye doctor for a routine checkup. After examining my eyes, she asked if I get headaches, and I mentioned I always seem to have one. She noticed my optic nerves were inflamed and mentioned that excess spinal fluid or a tumor could be the cause. She referred me to a neuro-ophthalmologist, where I had a brain MRI, a spinal tap, and new medication to regulate my spinal fluid. The neuro-ophthalmologist told me I was just about 6 months away from losing my vision. I was fortunate that I mentioned my headaches to my eye doctor. After the spinal tap, they removed about 100 cc's of fluid, and my pressure was measured at 42, while the normal range is 8 to 16, so, yeah, big middle finger to the neurologist who just handed me drugs without properly investigating the issue. Next story. I'm not a doctor, but when I was 16 and studying to be a nurse, I had a work experience placement at a nursing home. The worst thing I saw overlooked there was loneliness. One day, I had a little free time on my second day, so I went exploring to familiarize myself with the layout. As I walked by a room with the door open, I saw a resident, Mr. R, inside. He was coughing and spitting up phlegm onto his shirt because he had nothing else to cough into. I quickly ran to get him a box of tissues. While he cleaned himself up, I sat down across from him, just waiting in case he needed anything else. He noticed I was new and thanked me for the tissues. We started talking about the pictures in his room. He shared his life story with me, his time in the army, how he met his wife, how much he missed traveling to Sweden every year, and all the dogs he'd had over the years. He was the first person at the nursing home who spoke to me kindly, and I really enjoyed our conversation. He was funny, smart, and just an overall nice person. He had lived a long, interesting life, and since he had no children, it had been a while since he'd had a conversation with a teenager. After about 20 minutes, a staff member knocked on the door and told me I was needed. I said goodbye to Mr. R and promised to visit him again during my stay. I thanked him for making me feel so welcome, and he thanked me, then began to cry. He told me that no one had ever done that for him. Mr. R had been in the nursing home for 3 years, and in all that time, no one had simply sat down and talked to him, asked him questions, and really listened to him. No one had made him laugh or made him feel heard. I ended up making several formal complaints about the multiple issues I witnessed: manhandling, neglect, unclean environments, belittling language toward residents, and a general lack of care. It was the first time I felt both heartbroken and angry. As caregivers, one of the basics is that you have to genuinely care, and for some reason, those staff had forgotten that. There were a lot of things I saw at that placement that I'll never forget, but the feeling of isolation Mr. R experienced was by far the worst. Next story. A guy came into our ICU very septic but still talking. He had visited his primary care doctor a few days earlier, complaining of a sore throat, but was dismissed without any intervention because he didn't show signs of strep throat or the flu. By the time he came to us, he was experiencing severe abdominal discomfort, so we sent him for a CT scan. During the scan, he coded, required intubation, and went into multi-organ failure. The CT scan showed a terrible sight. His peritoneal cavity was filled with all kinds of substances. His wife then told us that the day before he saw his primary care doctor, he had choked on an ice cube. He had swallowed a whole double half-moon-shaped ice cube, which perforated his esophagus, causing a massive 4.25-inch linear tear. This tear allowed a large portion of his food and drinks to leak into his peritoneal cavity rather than his stomach. To make matters worse, he also had some reflux, which allowed stomach acid to leak into the cavity. likely while he was sleeping. Once we understood what had happened, he underwent extensive washouts and exploratory surgeries to repair the damage to his esophagus and other affected organs. Thankfully, he made a full recovery, but he was very close to not making it. Next story. I have a story that went in the opposite direction. A woman came into the emergency department complaining of extreme fatigue and spontaneous bruising. They ran some labs and saw that her white blood cells, red blood cells, and platelets were all low. Without doing any further confirmatory tests, they told her she had leukemia and would need chemotherapy. She was admitted to my service, absolutely terrified, crying and screaming in fear. I took more of her history and found out that she had recently been started on a medication for her rheumatoid arthritis, which can cause a decrease in blood and platelet cell counts as a side effect. I ordered additional tests, and there was no evidence of leukemia. We stopped the new medication, and within a week she was completely back to normal. It was a huge relief for her, and a reminder of how important it is to dig deeper before jumping to conclusions. Next story. I had an experience during my surgery rotation as a medical student that stands out. A patient came in after falling on the street and hitting his head. It turned out that he had actually fallen earlier that day as well, and had been discharged from another hospital after a trauma workup that showed no injuries. When we examined him, we noticed his eyes looked kind of yellow. Given that he couldn't provide a clear history, and we weren't sure exactly what had happened, we included an abdominal CT scan as part of our trauma workup. The scan revealed that his common bile duct was incredibly dilated, about 3 times its normal size, almost big enough to drive a truck through. Right around that time, his temperature spiked to 103 degrees Celsius. It turned out that he was suffering from severe sepsis due to ascending cholangitis, which was the reason he had been falling down in the first place. It was a big miss at the other hospital, and this is definitely an emergency situation that requires immediate attention. Next story. During my residency, I witnessed a cardiologist miss a STEMI, heart attack. The patient had been sent to us after the delay, and by the time he arrived, some of the muscles supporting one of his heart valves had completely died. He was in cardiogenic shock, meaning his heart was functioning so poorly that it couldn't circulate blood enough to sustain his life. It was a very serious and distressing situation. Fortunately, with intensive care and intervention, he managed to pull through. But it was a close call. It was a stark reminder of how critical it is to catch heart attacks early, as the consequences of missing them can be devastating. Next story. I'm so sorry for what you and your wife went through. This is an incredibly heartbreaking story. It's devastating to hear about the struggles she faced, not just with the illness itself, but with the lack of attention and care she initially received. The way she was dismissed for so long and the casual remarks from that doctor are infuriating. It's hard to imagine how much pain both of you went through during those months. The fact that your wife fought so hard through treatment and that she was taken too soon is something no one should ever have to go through, especially at such a young age. I admire your strength in sharing her story here, and I can only hope that it helps raise awareness and encourages others not to give up, just as you urged in your edit. You're right. This is not anyone's story except your own, and the fight for life and health is never over. No matter what obstacles arise, it's also encouraging to hear that, despite everything, you're finding ways to move forward with her memory and live in a way that honors her. Grief is a long journey, and I hope therapy helps you with your PTSD and healing process when the time feels right. Thank you for sharing this story with all of us. My thoughts are with you as you continue processing, and I'm so sorry for your loss. Next story. I had a patient, a young student from, I believe, Pakistan, who came in complaining of a stiff neck. He had visited a doctor a few days before and was told it was just joint pain that would pass with some common anti-inflammatory drugs. When I saw him, I noticed that many of the lymph nodes in his neck were swollen, which was likely causing the stiffness, but they weren't painful, something that raised a red flag for me. I immediately sent him for a chest X-ray, which revealed a large mediastinal mass, suggestive of lymphoma. Unfortunately, I don't know what happened to him after that, but it was a stark reminder of how easily something serious like lymphoma can be overlooked, especially when the symptoms don't match the initial diagnosis. It was heartbreaking to think that a simple issue like swollen lymph nodes could be the sign of something so much more serious. Next story. During my psychiatry residency, I was working in the psych ER one night when we got a transfer from the main ER. The family had brought the patient in for an altered mental status that had been gradually worsening over the past 2 weeks. The ER doctors had cleared her, with all labs and vitals normal, and they thought she was likely experiencing a mental breakdown or psychotic episode. When she arrived in our area, I went to assess her. She was non-responsive, staring off into space, crying, shaking her head back and forth, and mumbling. She couldn't answer any questions and seemed to be in severe anxiety. As a psychiatrist, one of the biggest lessons we are taught is to assume that any change in mental status is a medical condition until proven otherwise, and then you can consider psychiatric causes. Within seconds of seeing her, I had a gut feeling this wasn't psychiatric in nature. I looked through her chart and saw she had a history of blood clots. Although her vitals were normal again, I made an executive decision to order a stat CT of her chest to check for a possible clot. The technicians were a bit confused as to why a psych resident would order this, and even the radiology team called me to double-check if I had ordered it by mistake. About 30 minutes later, I got a call from the on-call radiology resident. She asked, "Are you the psych resident who ordered this CT?" I replied, "Yes, that's me." Thinking I might get a lecture about wasting their time, she said, "Well, you need to call the ER and have her transferred stat, because this patient has the most massive pulmonary embolism I've ever seen, and she will likely code any second." We immediately transferred her back to the ER, where she was admitted and treated for the clot. Within a few days, she was back to normal. After that, whenever someone joked about psychiatrists not being real doctors, I would tell them this story, and that usually settled it. TLDR. As a psychiatry resident, I caught a massive pulmonary embolism in a patient who had been cleared by the ER and misdiagnosed with a mental breakdown. Edit. A helpful Redditor reminded me that it was likely a CT I ordered, not an MRI. Correct. I just had an MRI on my knee, so it must have been on my mind. Next story. Not a doctor, but the patient. When I was born, I was my dad's third child. He had 2 kids from a previous marriage. From the moment I was born, he knew something was wrong with the way I was breathing. Very rapid, short breaths. By the time I was 3 months old, there was no change in my breathing, and my parents grew more concerned. The first hospital they took me to told them that there was nothing to worry about, and that babies just breathe like that. My dad, however, was 100% sure they were wrong. They took me to a second hospital, where the doctors confirmed something was definitely wrong, but they didn't have the technology to help. This was in 1986, so they recommended taking me to a third hospital a couple of hours away. At the third hospital, they immediately admitted me and performed surgery that very same day. It turned out I had 5 holes in my heart. The doctors initially tried to go through my rib cage, but it didn't work. They had to crack open my sternum and go directly through my chest. They actually took my heart out of my body to patch the holes. It was a scary experience, but thankfully, I survived and made it through the surgery. Next story. This is a really tough story, and I'm sorry for what you and the family had to go through. I was working nights when a patient came in for a nail bed repair under general anesthesia. It was a slow night. While anesthetizing him, he aspirated, so we did a chest X-ray to check for any spit or blood in his lungs. What we didn't know was that, for over 6 months before this emergency surgery, he had been seeing his GP for chest tightness. They had put him on different asthma medications, but nothing had helped. The X-ray revealed a massive dark mass in his left lung. At that point, we kept him asleep and transferred him to the ICU. His wife and 3-year-old daughter were waiting for him on the ward. We had to explain where he had gone, why, and what was going to happen next. He passed away from lung cancer within the month. Edit. I want to clarify that a general anesthesia for a nail bed repair was definitely overkill, but he refused to have it done under local anesthesia. A commenter below pointed out an important correction. After talking with a colleague, I learned that the dark space on the X-ray was actually the normal lung, and the rest was whited out because it was riddled with tumors. The man was in his late 20s, a non-smoker, and the whole situation stayed with me for months after it happened. It was incredibly hard to process. Next story, I work in EMS, and we got a call for a female patient with leg pain. When we arrived on scene, her leg was 3 times the size of the other one, blue and purple, and she had no pulse in her foot. She had fallen on ice a few days before and had gone to urgent care, where they didn't do any X-rays. The doctors there told her she had a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured that they were cutting into the blood vessels and muscle tissue. By the time we got to her, she had already lost circulation to the foot, and unfortunately, she lost her foot entirely. It was a heartbreaking situation, especially knowing that something as simple as proper imaging and diagnosis at the urgent care could have prevented it. Next story. This is a tough one. A patient came in with what seemed to be a fungal infection in the chest, and after many rounds of itraconazole, the plaque still wasn't responding. The physician called me in to check the patient again, and sure enough, the chest plaque looked very much like a fungal infection. Direct examination even confirmed the presence of the fungus, but nothing was improving despite the treatments. So I rechecked the patient's file, and that's when I noticed the leukocyte count was extremely low. I immediately ordered an HIV test, and it came back positive. This patient had AIDS in addition to the fungal infection. To the physician's credit, they called me for help, and they had no way of knowing the full story because the patient had lied during the clinical exam, stating that they had no active sex life. But when confronted with the evidence, the patient admitted that they had been regularly seeing local sex workers and was also quite active in online dating. Public health was, understandably, not happy to hear this. It's a reminder of how crucial it is to look deeper when things aren't adding up clinically. And of course, how important it is for patients to be honest about their history, even when it might feel uncomfortable. Next story. I'm not a doctor, but I'm a nurse, and not in med-surg. My sister had a routine gallbladder surgery, and 2 days later, she woke up at 4 a.m. in excruciating pain. She ended up going to the ER by ambulance, and I met her there. The ER doctors seemed convinced she was a drug seeker and didn't even bother to do a physical exam beyond taking her vitals. They gave her enough medication to sedate her and essentially quiet her down because she was desperately screaming, "Help me! Help me! I'm dying!" Eventually, they did an MRI, but it came back negative, and they sent her home. She insisted that something was terribly wrong, but they threatened to call security and have her forcibly removed. I'd also like to mention that she had no history of drug or alcohol abuse. The next day, she got even worse, so she went to a different hospital. They did a full workup and discovered that the metal clip used to close off her bile duct during surgery had actually cut through the tissue, causing a massive bile leak. The bile was burning her abdominal organs, and she had to undergo 3 surgeries to repair the damage. She spent 9 days in the hospital and was left with chronic pain from adhesions and chemical burns. When the new hospital obtained the MRI from the original ER visit, they pointed out that the leak, although small, was clearly visible in that image. It was devastating to see how poorly she was treated, and heartbreaking to know that a simple exam or better attention at the first hospital could have prevented so much pain and damage. Next story. I'm a dental assistant, and I had a patient come in one day with a strange color to his skin. He was complaining of jaw pain, and one of his teeth hurt as well. He had just come from his doctor, who told him to see us, but I was suspicious it might be something more serious, like a heart attack. I quickly put the pulse oximeter on him and nearly fainted myself when I saw the reading. It was only 82%. I immediately grabbed our emergency high-flow oxygen and shouted for the AED and 911. It turned out the guy was indeed having a heart attack. Thankfully, he survived, and a few weeks later, he brought me a big heart-shaped box of chocolates for Valentine's Day to thank me. I've never been so scared or so angry on behalf of someone else before. After the whole ordeal, the dentist I worked for called the doctor and said, "My 25-year-old assistant just saved your patient's life." It was such a scary moment, but it felt good to know that I was able to make a difference in that situation. Next story. I'm so sorry to hear about your friend. This is such a heartbreaking story, and it's frustrating to think that something could have been done earlier. My best friend was in her late 20s and was constantly irritated by stomach issues. She went to several doctors over the course of almost 3 years, but each one dismissed her symptoms as irritable bowel syndrome. She tried various diets, but nothing worked to relieve her discomfort. One day, she called me and said she thought she had broken her ribs. She had no idea how it happened, but the pain was unbearable, and her doctor confirmed that her ribs were fractured. It wasn't fractured ribs, though. The pain worsened to the point where she went to the ER, and they did a CT scan. It turned out she had stage 4 colon cancer, with 4-inch tumors in her abdomen pressing on her organs and causing all the pain. She passed away a few months later. She had been seeing doctors for her symptoms for 3 years. If one of them had listened to her concerns and sent her for a colonoscopy, she might still be alive today. Edit. I'm overwhelmed by all the kind words and support. Thank you to everyone. It's incredibly disturbing, but sadly not surprising, how many people have similar stories. If you feel something is wrong with your body, trust your instincts and don't let doctors brush you off. For the record, this did not happen in the US, but I want to keep my friend's identity private. The country is small, and she has a sibling who used to be active on Reddit. Any doctor could have ordered a colonoscopy, but it seems like it was easier to dismiss her rather than investigate further. The cancer might have eventually taken her life, but the real cause of her death was apathy. Next story. As a psychiatrist, it's incredibly frustrating to see how often patients don't receive proper care from some doctors, especially in emergency departments. While not all ED doctors are guilty of this, it happens far too often. One of the most egregious examples occurred a couple of years ago. During my overnight call at a VA hospital, it started as a relatively routine request to transfer a patient from a community hospital's emergency department to our psychiatric unit for psychosis treatment. The patient was an older man in his early 70s who had come in acting strange and delusional. His son-in-law mentioned that he had a history of psychiatric issues. I asked for the transfer packet, which should have included the assessments performed in the ED, and started reviewing his chart. Upon looking at the records, I discovered that he hadn't been admitted to our psychiatric unit. Instead, he'd been seen by our psychiatry consults team for delirium, while admitted to the medical floor for decompensated heart failure. For those unfamiliar, delirium can occur with any severe illness, where your brain doesn't function properly due to the physiological stress your body is under. It can cause confusion, disorientation, and sometimes delusions or hallucinations. His psychiatric symptoms were the result of delirium, not a primary psychiatric issue. I reviewed the transfer packet and was shocked to see there was no cardiac workup for this patient, who had a known history of heart failure. There weren't even any vital signs listed in the packet. The only lab results provided were a blood count, which was unremarkable, and electrolytes on kidney markers. While the chemistries were mostly normal, I noticed his urea nitrogen was slightly elevated, which can indicate poor perfusion through the kidneys, often a sign of dehydration or reduced blood flow, which could occur if he had uncontrolled heart failure. So, I called the ED and informed them that I wouldn't accept the patient onto our psychiatric unit without at least a basic cardiac workup. I explained that his psychiatric symptoms seemed to be tied to his heart failure, and that the limited data they had sent suggested the same thing might be happening again. They said they would get the necessary labs and vitals and reach out to me. A couple of hours later, I was in the ED when I overheard one of the ED doctors mention a patient coming to the medicine floor from the same community hospital. Curious, I asked if it was the same guy with decompensated heart failure, and I was shocked to learn that not only was it the same patient, but he had been actively having a heart attack in their ED. At that point, I was absolutely furious. This outside ED had tried to send him to our psychiatric unit without even taking vital signs or realizing that he was having a heart attack. I had to explain to medical students repeatedly that just because someone is acting strangely or has psychiatric symptoms doesn't mean you should just label them as a psych patient and ignore their other medical needs. This case highlighted how critical it is to treat the patient holistically and not overlook the potential underlying medical issues just because a person's behavior seems unusual. This was a clear example of how easy it is to miss life-threatening conditions when we focus too quickly on the psychiatric label. It's a lesson that should be passed on to every healthcare provider, especially those working in emergency or psychiatric settings. Next story. During my training, I encountered a child who was suspected of having meningitis. At the time, I was new to pediatric medicine, but something about this 4-year-old patient struck me. He just looked too sick to be dealing with a typical childhood illness. What really tipped me off was a slight delay in his pupillary reflexes. That wasn't something I had learned to expect in a regular sick child, and it raised a red flag. After seeing the child, I asked the head pediatrician to perform a lumbar puncture to check for signs of infection in the spinal fluid. She dismissed it, saying there was no need. She explained that it was likely an airborne virus going around at the time, and that an unnecessary lumbar puncture could cause trauma to the child. While I didn't agree with her, I hesitated, doubting my own assessment and assuming that someone with tens of thousands of hours of experience would surely know better than me. I reluctantly wrote everything down in the patient's chart and asked the pediatrician to review my evaluation afterward. After a long, exhausting 14-hour shift, I went home and tried to put it out of my mind. 3 days later, the child came back with fulminant meningitis, which had taken a severe turn. When discussing the case, the pediatrician mentioned noticing strange pupillary reflexes in the child. She had completely overlooked my earlier evaluation and, as it turned out, never read it. I realized that not only had she disregarded my suggestion for a lumbar puncture, but she had also dismissed the warning signs I had noticed. That moment was a turning point for me. I learned never to doubt my gut feeling, no matter how much experience someone else has. Trusting my instincts has helped me with some difficult and outlandish diagnoses since then, and it's a lesson I carry with me in every patient interaction. Next story. I had a patient who came in lactating, but she wasn't pregnant or breastfeeding. Her previous doctor had told her that it was just residual milk from when her baby had been weaned 14 months prior. However, I wasn't convinced, so I sent her immediately for a brain scan. The scan revealed a brain tumor. She had surgery a week later to have it removed, and, thankfully, she is doing very well now. Edit. Wow. I didn't think anyone would even read this, and I wish I had explained things better and sounded more professional. I want to clarify that I did not do any follow-up care. After seeing the patient, she left my office with a referral for an MRI and another for an endocrinologist, who took over her care. Also, please, if you're concerned about your health or feel uncomfortable with your doctor's care, make sure to obtain your medical records and seek a second opinion from another healthcare provider. Don't ask for medical advice from strangers on the internet who don't have access to your complete medical history. It can be very dangerous to your health. Next story. As a medical student, I was working an ED shift when we saw a patient who had probably experienced a missed testicular torsion. The previous doctor had told him he likely had cancer. However, by the time he presented to our ED, his testicle was likely already dead, something that had been missed during his initial visit weeks before. To anyone with testes, especially young men, if you experience sudden, excruciating pain in the testicles, sometimes without any apparent activity or often after activity, go to the ED immediately. Testicular torsion is one of the few conditions that would make a urologist drop everything and rush to the hospital, even on a weekend. Edit. Much love to urology for their quick response in these emergencies. Edit 2. My experience was with a male patient, but ovarian torsion is a similar emergency that requires the same immediate attention. Next story. As a resident doctor, I had a case that really stuck with me. We saw a kid in the emergency department who was having difficulty walking. He had been slowly losing his ability to walk over the past few months and was also experiencing random, unexplained episodes of projectile vomiting. Looking through his records, I saw that he'd visited his doctor several times, who x-rayed one hip, then the other, and gave him some Zofran for the vomiting, but nothing else seemed to be addressed. When I examined the patient, it was obvious to me, even though I was still early in my training, that he was severely ataxic. His coordination was terrible, and he couldn't even stand. He failed all of our bedside neurological exams for cerebellum function. It was clear something was very wrong. I immediately ordered a CT scan. The scan revealed a huge tumor in his cerebellum. It was obstructing the fluid drainage in his brain, which was raising his intracranial pressure and causing the vomiting. We had to call in the neurosurgeons overnight for an emergency procedure to drain the fluid, and he was sent to the ICU. He later had more surgery to remove the tumor. My supervisor got really emotional about it, and I understood why. This child had been misdiagnosed for months, and it was a huge relief to finally have a diagnosis and get him the care he needed. Edit. Thanks everyone for your comments and support. To clarify, the kid had really declined over the last few days before his ED visit, so by the time we saw him, he looked very sick. I'm not sure how he looked before, but it was clear he had deteriorated significantly. To any medical students reading this: 1. Do an exam. It's easy to miss something important if you skip it. 2. It's okay to cry sometimes. We're human, and this work can be emotionally overwhelming at times. Next story. During my trauma and orthopedics rotation at a small hospital with a less-than-ideal A&E department, I was asked by the medical team to review a 67-year-old lady who had fallen at home. She had shoulder pain, and A&E had already x-rayed her, ruling out a broken collarbone and shoulder. They referred her to the medical team to investigate the cause of her fall. Despite the x-ray being clear, she still had significant pain, and the medical team didn't fully trust A&E's assessment. So, they asked me, still a bit chubby, but mostly competent as a trauma and orthopedics SHO, to take a look. I started by reviewing the x-ray first. There was nothing broken in the shoulder, so I went on to examine the patient. The shoulder had some bruising, but there was a good range of movement. When I palpated the shoulder, I felt something odd, a lumpy, bubble wrap-like sensation under the skin. Instantly, I thought, holy shit, this is surgical emphysema. I went back to the x-ray, where I noticed a snippet of lung at the edge of the image and saw a big pneumothorax, punctured lung, along with a hint of some broken ribs. I immediately called for an emergency chest drain and arranged for her transfer to the trauma center. Fortunately, the patient survived. Looking back, I don't think the ED doctors even laid hands on the patient. They just looked at the X-rays and referred her on. Surgical emphysema, in case you're not familiar, is when air gets trapped in places where it shouldn't be, like the skin and subcutaneous tissue, which happens when air escapes from the lung after a puncture. It was a good reminder of how important it is to do a proper exam and not just rely on imaging or assumptions. Next story. Chan T. Twitter. My husband and I went through a lot in the beginning of our marriage, almost to the point of divorce, because he would go through phases where he behaved like a completely different person. I had noticed it before we got married, but it became much clearer once I stopped working and we were spending more time together. He had a rough history, starting with a felony in middle school, then getting into trouble in his early 20s with drugs, burglary, and reckless behavior like drinking and driving. He ended up in prison and was diagnosed with things like narcissistic personality disorder and sociopathy, but never really received any treatment or medication. One doctor even told him he was untreatable. Despite all that, my husband made huge strides after getting out of prison. He stayed sober for years, got a bachelor's degree with honors, and moved to a new city. But before I met him, he started struggling again with alcoholism. We partied a lot when we first got together, which hid some of the problems. A few years into our marriage, I noticed that my husband would act totally different, almost crazy sometimes. These periods would last about 2 weeks, and then he'd go back to being normal again. I started charting his behavior and the things he said because he would contradict himself. Like one day saying, "I never need more than a few hours of sleep, babe," and then 2 weeks later saying, "I always have a hard time getting up in the morning, babe." I dug into my old DSM-IV from college, I was a psych major, and compared his symptoms to bipolar disorder. He seemed to meet almost all of the qualifications. I convinced him to start therapy, and after just a few sessions, bingo! He was diagnosed with bipolar disorder. But even with the diagnosis, everyone was hesitant to prescribe medication. Another year went by, and he was still really struggling. Finally, he went into a full-blown manic episode, saying he felt like he couldn't control himself. So I took him to the ER. In the ER, I told the doctor that I wasn't leaving until he got medication, because it was clear he was suffering and needed help right then and there. The doctor not only agreed, but she called his therapist and lectured her for not pushing harder for medication. They gave him a hefty dose of Seroquel, and we went home. He slept for 2 days straight. When he woke up, he was back to his normal self. It took another 2 years of trial and error with medications to find the right balance, but the difference it made is incredible. A huge list of problems he'd had, like excessive sweating, rapid heart rate, insomnia, difficulty maintaining weight, and daily nausea, disappeared once he was properly medicated. Even his alcoholism completely went away. He now struggles to finish a beer and rarely even opens one. Now, he's as normal as someone without mental health issues could be. And he often wonders what his life would have been like if he had gotten the proper help sooner. He never stood a chance without medication, really. And even when we knew what was wrong, I can't help but think about how much easier that year of our life, when we almost divorced and my own mental health started spiraling, would have been if he'd gotten medication right away. Mental health is tricky, and I know it's not always easy to diagnose or treat, but the fact that so many professionals overlooked or dismissed his issues for years is incredibly frustrating. He was treated like his problems weren't serious enough to warrant proper help, and that year nearly broke both of us. It's a relief to see him doing so much better now, but it was a long road to get here. Next story. I'm so sorry for what you and your daughter went through. It's heartbreaking to hear how she was dismissed for so long, and I can only imagine how frustrating it must have been for both of you. You started taking your daughter to doctors for abdominal pain when she was just 12 years old. Her pain was excruciating. She couldn't function. And yet, no matter how many specialists you saw, they all told her it was in her head. This ongoing dismissal, combined with everything else going on in her life, contributed to significant mental health struggles, which must have made everything so much harder for her. When she was 19, she ended up in the ER again for abdominal pain, and this time they discovered a cyst on her ovary. A few weeks later, she was scheduled for surgery to remove it, but the surgery lasted a couple of hours longer than expected. And when the surgeon came out, they said, "That is the worst case of endometriosis I've ever seen in my entire career." As a gynecologist, those are very heavy words to hear. At 21, after exhausting all options for managing the endometriosis, she had to have a full hysterectomy. Even while prepping for that surgery, the surgeon who specialized in endometriosis and was one of the best in the field was warned by the nurses and anesthesiologists that this was one of the worst cases they had ever seen. I can completely understand why you want to go back to all those doctors and ERs and say, "She wasn't faking it." It's so important for doctors to listen to their patients and take their pain seriously, but it can be an uphill battle when something isn't immediately visible or easily diagnosed. I hope sharing your daughter's story helps raise awareness about conditions like endometriosis and the importance of believing patients, especially when they are suffering silently. I hope your daughter is doing better now and has found some peace after all of the medical challenges she's faced. You did everything you could to help her, and your persistence in advocating for her care is admirable. No one should have to go through what you both did, and I hope this story helps others who may be struggling to get the care they deserve. Next story. When you were a toddler, your extended family noticed that you walked with a waddle, but your parents didn't think much of it because they had gotten used to it. However, your grandma and aunts, who saw you less often, insisted that something was wrong and that you had a limp. Your mother, worried, asked your pediatrician about it, but he reassured her that it was nothing and would likely fix itself as you grew. But as time passed and it didn't get better, actually, it got worse. Your mother insisted on an X-ray. The doctor snapped at her, refusing to do the X-ray and again insisting it was nothing, although he reluctantly referred you to a specialist. The specialist suggested something as bizarre as wrapping wool around your leg to warm it up and help it grow faster. Thankfully, your dad had had enough of these misguided explanations. When your regular pediatrician was on holiday, his partner came to see you, and that's when everything changed. This new doctor noticed that your legs were different lengths by about 4 to 5 centimeters and immediately sent you to a specialized children's hospital for urgent treatment. It turned out that you had severe hip dysplasia, so severe that your right hip had no socket for the femur bone. 3 years and 3 surgeries later, along with months of physiotherapy, you were able to walk normally again. If that second doctor hadn't caught it, you could have grown up with a disability. After everything, the second doctor split from his partner, your original pediatrician, and now he's the pediatrician for your daughter. Your story is a powerful reminder of how crucial it is to trust your instincts and seek second opinions when something feels wrong, especially when it comes to your child's health. It also highlights how important it is for doctors to listen to patients and their families, as you could have faced a very different future without that second opinion. I'm glad you had such a positive outcome, and now your daughter is in great hands with that second doctor. Next story. I'm so sorry to hear what you and your husband went through. It's beyond frustrating and heartbreaking when a medical professional dismisses a patient's concerns, especially when it results in something as serious as a delayed diagnosis. Your husband's story is a painful reminder of how crucial it is for doctors to listen to their patients and take their concerns seriously. The fact that you went to multiple dermatologists and were repeatedly brushed off, only to find out much later that it was a sarcoma that had grown for 10 more years is infuriating. The delay in diagnosis is incredibly upsetting, and it must have been incredibly difficult for both of you to have to wait so long before seeking help again. The scar your husband now has is a permanent reminder of that experience. But the most painful part is probably the unnecessary suffering and the added complexity of dealing with wound drains, bandages, and all the associated care. Not to mention the emotional toll it takes on both of you. I totally understand your anger toward the first dermatologist. Dismissing genuine concerns and being patronizing is unacceptable, especially in a field where trust and communication are so important. It's good that you eventually found a doctor who took the issue seriously, but it doesn't undo the years of delay or the impact it had on your husband's health. I hope your husband is recovering well now, and that this experience doesn't deter you from seeking proper care in the future. No one should have to go through what you did, and I'm glad you're sharing your story. Hopefully, it will encourage others to advocate for their health and not settle for dismissive doctors. Next story. I'm not a doctor, but I work as a scientist. Last week, a colleague of mine left a pile of blood samples for me to review. After a long night shift, they mentioned the samples were routine and that I could take a look at them whenever I had time. I decided to go through them right away. The first sample I examined was from a man with a very low hemoglobin level of 43 and a platelet count of 37. The slide was filled with abnormal cells. About 40% of them were blasts. Right away, I thought of acute leukemia, so I called urgent care and informed the consultant, who promptly brought the patient into the hospital. I spoke with the consultant today, and they told me the patient works offshore and is actually managing quite well with his condition. It turns out my colleague didn't miss the diagnosis, but they accidentally skipped that particular slide in their review. Next story. I'm not a doctor, but my mom is a nurse. When I was 15, I fell on my wrist while playing football at school. The school nurse, who was friends with my mom from work, told me to keep an eye on it and see how it felt later. By the afternoon, my wrist was killing me, but my mom wasn't too concerned. She said if it hurt that much, I was old enough to cycle to the doctor's myself. I tried to explain how hard it would be to break and use my wrist. After a lot of complaining, she finally took me to the doctor, and then we went straight to the hospital when they confirmed it was broken. She sat quietly in the waiting room after hearing the diagnosis. Fast forward 3 years. My stepbrother came home for the weekend from university with a sore wrist from a fight. Mom gave him the same, "It's fine, stop complaining" response. He went to the university health center when he returned, and they sent him to the hospital for surgery, where they put a pin in his wrist. Just to clarify about the comments, people have said my mom must be a terrible mother and nurse, but that's the complete opposite. She's been a great mom and is now a wonderful grandmother. She's also highly respected in her nursing career, but as some other kids of medical professionals have pointed out, there's something about how they react to their own kids' health issues. It seems like all the medical logic goes out the window when it's their own child. I've met many people with similar stories, and it's been funny sharing these experiences. Next story. I'm not a doctor, but when my son was 2 years old, he wasn't pooping properly. His stomach was getting bigger, and it seemed like he was eating more than he was getting rid of. We talked to our family doctor, who suggested a laxative or some natural remedy. I don't remember the details, but when I mentioned it to another doctor later, they were shocked. A few months went by with no improvement, so we took him back to the doctor. She gave the same advice. I asked, "What if it doesn't get better?" And she said, "It definitely will." But it didn't. After a few visits to the ER and a lot of doctors asking frantic questions, we finally found out that he had Hirschsprung's disease, a condition where the nerve cells in his colon are missing, so his body didn't know when to poop. He had emergency surgery and is doing much better now. It was really scary for a while, though. Shortly after, our family doctor decided to retire early instead of facing a disciplinary hearing from the medical board. I don't know the details, but based on how upset the surgeon seemed about how things were handled and the timing of everything, I suspect the surgeon reported our family doctor for mishandling the situation. Next story. This might not be the worst, but definitely one of the most unnecessary situations. A 3-year-old girl was brought in for what were thought to be seizures. She had been having leg shaking and stiffness and not responding. Her pediatrician had been treating her for over a year with 2 different anti-epileptic medications, and she had even been taken out of daycare because they didn't know how to handle the episodes. The mother was terrified, nothing seemed to help, and the seizures were getting worse, happening multiple times a day. The mom showed me a cell phone video of one of these episodes. It was clear that the toddler was rubbing her legs together, a common behavior in young children. It's something toddlers do sometimes, and it is not a sign of abuse. Because we needed to confirm that it wasn't actually seizures, we admitted the child to the hospital. We attached EEG electrodes to her head, stopped her anti-epileptic medications, and watched her on the EEG and video to see if she would perform the behavior again, to prove it wasn't a seizure. The girl was understandably scared with all the wires, the strange people, and the painful blood draws. She was not in the mood to show the behavior. I spent a week waiting for her to feel comfortable enough to do her leg rubbing, and when she finally did, we saw that it wasn't a seizure. We stopped her medication, reassured her mom, and sent them home. It was a frustrating experience, but in the end, we were able to figure it out.